lack of funding in Ontario hospitals is having a negative impact on patient care times. The researchers have highlighted that hospital deficits have increased in recent years. Locally, Windsor Regional Hospital had nearly a $40 million deficit last year. They project to have a $20 million deficit this year, so obviously a significant reduction, but a large deficit nonetheless. Now, coinciding with these deficits, the wait times have also increased. Admission times locally have increased 72% since 2021. It's now noted that 90% of patients in the ER are waiting 34 hours for a bed, which is up from 19.5 hours. So almost a day to a day and a half to get admitted to the hospital if you need to be. Now, the researchers call this increased wait time the canary in the coal mine. They suggest that this indicates the system is under stress and near a breaking point. The researchers also say that Ontario spends the least per capita out of all provinces on its hospital system. Now, for their part, the Ministry of Health denies the report, says its findings are misguided. They point to investments that have been made to the government and changes in government funding, both provincially and locally. Specifically, they've pointed out a 35% increase in Windsor Regional Hospital funding since 2018. So, do we think there's a link, and I realize this may be a bit of a loaded question for you, MPP Dowie, but do we think there's a link between these deficits and the wait times?
Well, I think on the wait times, I'll start there. When your baseline is the depths of the COVID pandemic, when people are not leaving their homes and establishing that as your base, then the data you're going to be extrapolating from that is going to be off. You have to use a normal year as your starting point. You can't use the lowest demand in the hospital system and then say, well, now today is radically different, is so much radically different. People were not leaving their home during COVID-19. They were not going to the hospital. There's a fear of infection. I know it's been a few years, but this still is relevant information. And when you don't acknowledge that and don't tell people that this is your baseline year, then it calls into question the remainder of the study findings. Hospital spending, or healthcare spending rather, has gone from $61 billion in 2018 to $101.2 billion this year. So is this really underfunding? It is increased by well over 50%. It's not a matter of the dollars not making it to the hospital, it's a matter of our demand on the system. And that's why you see from the government, we're moving things out of the hospital or to moving them away from your traditional path. For example, pharmacists can treat certain ailments and they can do their own renewals now. You're seeing on imaging some changes. You're seeing changes on optometry. You're seeing changes even where you're getting your medical care done. The Windsor Surgical Center is a great example where the ophthalmologists from the hospital, they are controlling the operating room now that they work. So instead of sharing the operating room at the hospital, they create their own operating room in their own building. And now the operating room of the hospital is being used 24/7 to reduce backlogs in other fields. And the ophthalmology is in their office. And your family physician has their own office. So by increasing the capacity to respond to ailments, that is actually going to improve these outcomes, reduce wait times, because you don't have to go to the hospital for absolutely everything.